So we'll now have our last session for today. So thank you to Matt Moore for joining us, Matt from the Institute for Urban Indigenous Health. So Matt, if you wouldn't mind just identifying yourself and your organisation for the purpose of the public record, and then I'll hand over to you for your presentation.
Hey, thanks, Karen. Matt Moore, General Manager, Age and Disability Services for the Institute for Urban Indigenous Health, based here in South East Queensland. The Institute really is like a regional body for the 4 Aboriginal medical services that look after the Aboriginal communities in South East Queensland in the corner.
Thank you. You're welcome to make your comments.
Alrighty. Thank you. So thanks, Commissioner, for this opportunity to advocate for Indigenous people with a disability and their communities in which they live here in South East Queensland. It's important to note from the Institute's perspective that we were late to the game around the NDIS and the disability services, and we really only stepped into the space due to the lack of activity in the space for the Aboriginal community as the NDIS was rolled out in Brisbane and Queensland. We'd also like to acknowledge the draft report highlighting some of the barriers faced by Aboriginal people. It did highlight some when accessing the NDIS, and even though the Aboriginal access is still significantly lower rates than the mainstream, with the end of the 2019 data, which is the last full data set we could, 49% of the initial expectation for Aboriginal access is unmet, compared to 86% of the broader Queensland population over the same period. So we put to the Commission that that there are 3 significant areas where we believe the report sort of failed or lacked to adequately address. The first one, market failure for Indigenous people with a disability in urban settings, so I don't think has been highlighted strongly enough. The second one, the need for more specific recommendations with some real substance around the closing the gap commitments, including implementing Indigenous specific access plan, build and service delivery pathways, which will create the desired marketplace for Indigenous people with disability. And the third is about setting some mandated targets around access for Aboriginal people and Aboriginal and Torres Strait Islander people to enter into the scheme. So that first point about the urban settings, really not clear that 80% of Aboriginal and Torres Strait Islander people live in urban settings. And in the major city here, region of South East Queensland here, there's close to 40% of the state's Aboriginal population reside, and over 11% of the national population are in this South East Queensland corner. The key point really is that culturally thin markets aren't just in rural and remote settings, they're also in urban settings as well. Research clearly demonstrates that people with disability are twice as likely to experience barriers to entering mainstream services than Indigenous people without disabilities. So despite a more mature mainstream market in the urban setting here in South East Queensland, this doesn't relate to Aboriginal and Torres Strait Islander access. Aboriginal and Torres Strait Islander people aren't accessing these services, and they won't access services. By not highlighting this critical factor, the report sort of fails to identify that thin markets adversely affecting the majority of Indigenous people with disability across the state, especially in the South East corner. Secondly, regard to the Indigenous specific access plan building and service delivery pathways. There are really clear commitments under the new National Agreement on Closing the Gap for structural transformation and change to occur within the NDIS. At the core of these commitments is the need to roll out Indigenous designed, led and delivered services through community-controlled organisations. This includes needs to include the parallel Indigenous-run access pathways of LACs and ECI services delivered by Indigenous organisations, as well as Indigenous-run NDIS service providers, and for this to happen, structural change needs to occur within the existing mainstream pathways. The Aboriginal community-controlled health sector is an example of how this can be done. We suggest that these health organisations can be leveraged to expand in the disability space through building on established services. This will not only build trusted relationships, but also support the important integration of health and disability for the Indigenous communities. Thirdly, we believe there should be specific access targets set which reflect not only the demographic data but also capture the additional layers of disadvantaged Indigenous people with disabilities experience. A minimum of 7% of the Indigenous population and not Indigenous access as per participants should be set. This is based on the estimates from the latest research in the AIHW. The lack of access for Indigenous people with a disability is contributing to the underdevelopment of appropriate markets, and there is no real understanding of the direct impacts of what this means. Any subcontractor or partner organisation in the NDIS should be set mandated targets around access and engagement with Indigenous people with disabilities and publicly report against these targets at the service area level. Yeah. So, in conclusion, we think the report articulates well most of the issues that we believe impact on the Indigenous engagement with the NDIS. However, we believe that the report is thin with some solutions or provisions for change, importantly the examples that we gave. I think there currently is an opportunity to respond to the access concerns by leveraging the timing of the re-tendering process for all LAC and ECI partners due at the end of this financial year. And we encourage the Commissioner to consider a specific recommendation that this process includes and encourages provision for Indigenous specific tendering opportunities, including in urban settings. And we also recommend or encourage the Commission to consider recommending that specific resources be identified to support the growth and development of community-controlled organisations to enter into the market of disability service provision, as they are best placed to provide the most appropriate service to their communities. This should include opportunities to leverage the existing network of Aboriginal health services. So that's it, and all of that stuff's in our latest reports, so we've handed it to you anyway.
Thanks very much, Matt, and we certainly appreciate the participation of the Institute in the inquiry and the submissions that you've made. So on the issues that you've raised, I'd be really interested to get your feedback on whether you see value in addressing the issues of Indigenous underrepresentation through the proposed new national outreach strategy. Do you think that that is a potential way of addressing the issues that you've raised?
Yeah, well, I think the best way to address the issues that we've raised is by local trusted entities that are ones who are at the coalface to do the work. Mm-hmm. So national solutions, I think, are good. Aspirational. But I think where the rubber hits the road is the leveraging of the trusted relationship with the local community, and where Aboriginal people can stay engaged with their local community is where you're going to get the most wins. So I don't know if that answers your question, but
it does. And obviously you see a greater role for community-controlled health services in providing better access and support through the NDIS. Do they currently have the capacity to take on those additional roles?
I think the Aboriginal Health Services is the best example nationally of Aboriginal and Torres Strait Islander community-controlled organisations doing some really good work for their communities. I think that currently they're the best example of community-controlled organisations with good governance structures, and due to the fact that the holistic care of their clients, so not just the primary health care but all of the other wraparound services and the holistic care that they provide, that I think it's a no-brainer that disability should become part of those suite of services. I think the issue potentially with some is the scale, the size, and the size of the communities and the size of the work that they've got. But I think that some sort of regional solutions, Aboriginal health services would work well together for regional solutions across that. And I think that there'd probably be varying capacity at this stage to be able to roll out disability services immediately. But again, with some investment, I think that there's a really good basis of good community organisations, good governance structures, and good connectivity to their communities that I think would be the best place to leverage to roll out some of these services, yeah.
So we've obviously seen the NDIS in Queensland now for around 5 years.
Okay.
And you mentioned the issues around Indigenous appropriate service delivery, even in southeast Queensland. Why are we seeing those barriers to culturally appropriate service delivery, even in the southeast corner?
I think there was issue with the way that the project was rolled out. Without being overly critical, I know that it was quite a huge thing to roll out this large program. is it the biggest since Medicare, I think, the NDIS. But I don't think the engagement was targeted appropriately initially for the Aboriginal communities. I think they all came late to the game. Like I said, we came late to the game thinking that everyone was going to be across the NDIS and we just have to tap into whoever's. But I think even to this day, I think I'm still right in saying I don't think there's community-controlled disability service providers in the Brisbane catchment. And again, because the mainstream market is a bit more robust, I think there's an expectation that Aboriginal people will just access those services. Our experience is that Aboriginal people won't access those services and don't. As we said in our report, and some of the research shows that, there's actually significant barriers to Aboriginal people going to mainstream providers. So I think our experience when we got into the disability space was that everybody focused on the service delivery and the price points of the services you can get and tried to think about how they could establish a business and make money from that other end without thinking about the community engagement strategies, the access pathways, the appropriate building of plans, and the advocacy for the support for the carers and the participants through those processes, so that they could then actually get a plan that was appropriate, and B, have actually options about how they could actually access the services for those plans. So, yeah, I still think that the Aboriginal and Torres Strait Islander service delivery market is extremely dearth of anybody that's providing good, appropriate care.
And does the NDIS price guide reflect the true cost of service delivery to Indigenous people?
Bit hard for me to comment. We're not into the service delivery space yet. We're just dipping our toe in at the moment going. We've concentrated on access and doing that. Again, I think from our experience, I think that all of the work that has to happen at the front end I don't think is recognised by anybody. So the community engagement and all of that advocacy work about getting to the appropriate plan lodged. I think once you get to the service delivery part, there may need to be some incentives to get Aboriginal community control providers into the space. But I think it's hard for me to comment about the price points with such a range of, without us actually having to deliver those services at this stage.
Where are you seeing the biggest advantages for Indigenous people in the NDIS? Where is it producing the best outcomes?
We were really fortunate to be able to run a pilot project for the access pathways, 18 months, and it was a pilot project of national significance. Unfortunately, it is finalised now, and unfortunately the evaluation that we hoped didn't take place, so we could actually, but we had some really good wins, so much so the NDIA's own data demonstrates that through that 18 months we were able to increase the access by more than 3% and increase by more than 3 times, and increase the actual lodgement of appropriate plans, the uptake of plans by 10 times out of the mainstream system. And that purely was around the Aboriginal and Torres Strait Islander engagement, advocacy, support through the information sessions, and then by being able to culturally appropriately work with families and potential participants for the journey through to the lodgement of an appropriate plan. That's the most rewarding of any of the pilot projects or anything that we've done in or outside of disability service in the last 5 years for the Institute. Really good, yeah.
So some good data there that you can quote in terms of the value that you've provided in the access process. Given that you're not in direct service delivery but contemplating it, obviously we've heard today significant issues surrounding workforce, and workforce development has been a common theme of conversation. Where are the barriers in growing the Indigenous workforce in this space? Have you got any direct insights you can share on that?
A couple of barriers. The most obvious barrier is that really it's a casualised workforce with the way that the market sets up and the way that the organisations, the consumer-directed care part and the risk that's taken on by the organisations. It's hard to guarantee, certainty for employees in that space. But secondly, and again, our lived experience when we rolled out aged care 7 or 8 years ago was that because Aboriginal and Torres Strait Islander people weren't receiving aged care services, their community weren't interested in getting educated to be able to provide aged care services. I think the same is true for disability. The fact that there's very limited disability service provision in the communities, there's limited interest by community to get into the field without encouragement to get into the field. So the Institute's been really fortunate again, being a regional entity and looking at the 4 member services, will, through our aged care employment strategy, which was around getting younger people trained up in Cert 3 and individual support, we've been able to expand that now and get their disability skill sets at the same. So what we've been fortunate enough to be able to do is build a blended workforce for aged care and disability where they can cross over, and we continue to try and educate young ones to do that. Again, I'm not sure if that answers your question.
No, it's helpful. So are there any other comments you'd like to make, Matt, on the recommendations within the draft report?
Yeah. I think the 3 big things, again, for us is that Aboriginal people and Torres Strait Islander people don't just live in rural and remote, don't live in remote settings. 80% of the population live in large urban settings or large regional settings. And I think there's a misunderstanding, a misconception that they just think that if you're close to proximity to services, that Aboriginal people will be serviced. But so really highlight there are thin markets across the whole country, no matter what the setting for Aboriginal people. I also think that setting of access targets for not just community control providers, but for any of the partners in the NDIS to make people accountable for, what they're doing in the space, because Aboriginal and Torres Strait Islander people typically take time. Time costs money. When people are under the pump, then the ones that get dropped are the people that take the most time. So if there's not engagement of appropriate providers or appropriate organisations in the space, then at least the NDIA and the mainstream providers are going to need to be held to account about what they're doing for these vulnerable people in the space as well. Maybe they're the 2 messages that we think we've got to try and get some cut through with you. And the closing the gap stuff. So to close the gap, there are no disability closing the gap targets. COAG or now the Coalition of Peaks, and we're really pushing to try and get some targets set because people with disability deserve to have some of that stuff as well.
Well, thank you for appearing today and for your submission, and we'll certainly reflect on the feedback that you've given us on the draft report when it comes time to finalising the report over the next few weeks. So thanks again.
Thanks, Karen. Hopefully it was helpful.
It was. Thank you. So we might close today's hearing a little bit early. So this is the second and last day of our public hearings for the inquiry. I'd just like to thank everyone, both here in the room and those joining us via the live stream, for their participation and interest in the inquiry. And I encourage you to visit our website where we'll post the submissions that we've received on the draft report. We certainly encourage you to remain connected with us as we move towards finalising our report for the Queensland Government. So thank you again, and enjoy the rest of your day.